the way that I introduce Aiden is that as a enterprise marketplace for healthcare goods and services. And what I mean by that is that we often think about the healthcare decisions that we all make out in the world. Which doctor am I going to go see? Which pharmacy am I going to go to? But a lot of patients, and actually the majority of decisions about who you see and what's going on with your care once you're involved in a little more of an acute situation, is really not so much you. And there's a whole infrastructure built in the healthcare system called case management to help you negotiate this whole process. And so we are here, to kind of like connect that whole massive amount of healthcare purchasing that's happening by healthcare organizations kind of through care management. We want to help those folks guide patients to the best quality provider every time on time. I'd say generally our interest in working with case management has been to reinvent workflows. So the referral workflow being a primary workflow that we've spent a lot of time on. And that idea of the kind of auction referral, as some people refer to it, I don't call it that necessarily. But that's something that's baked into the platform and that we've been rolling out marketplace by marketplace across the country for over a decade. And to explain kind of, quickly what the concept is, high level, most of the interactions that happen between healthcare organizations, whether it's provider to provider, hospital to nursing home or nursing home to home care agency, or whether it's provider to payer, these interactions that are business critical transactions are done 1,000,001 different ways. And there's actually not a standard expectation for, after I send my referral to you, how long will it take for you to let me know whether or not you can take my patient? And then how long do I have to respond back to you that the patient chose you? This is all kind of nebulous and managed by individuals today. And so a core part of what we do when it comes to referrals, same thing when it comes to authorizations, pre-certs, transportation, DME, whatever we're talking about, is build a very clear structure for exactly the 5 steps that happen every time I send a patient to a skilled nursing facility. And we're interested in tracking not just the steps and the timing that I'm responsible for, but also what is my external partner? What am I holding them accountable to? And so building a workflow that tracks and times every step of the way so we're in lockstep on every flow is really what Aiden's all about. And this auction idea is the idea that, rather than kind of make a patient limit their choices up front on what providers they're looking at, let's actually enable the providers to have more visibility and more power over which referrals they have a chance to review and kind of offer their care to. And then let's go to the patient and be able to present them not just with the first provider who wrote back, but with all of the partners who are available and interested in caring for you. And now let's compare them against their quality, against their partnership, against how they treat our community, so that as a system and as an ecosystem of healthcare, different providers can be rewarding partners who are delivering their patients the best quality care in the way that they deem, and getting them more referrals and more patients as a result of it. So really building just a healthy functioning marketplace for these thousands of patient transitionings that hospitals and health systems are managing. Fundamental part of healthcare, obviously, is dealing with our payer ecosystem. So yes, of course, you can kind of think of cost in 3 layers, and you kind of set me up with this. So I think cost to the patient, the number one first thing that we're doing, and this is where we actually use some AI to really generate and leverage the right search results. But first thing is I have to find providers who are in network, who are not going to send me an exorbitant check at the end of this day and say none of this was covered. That is not going to be an acceptable service. So a case manager's first job is, and probably hardest job, is to be interacting and finding providers that are in network with this patient. That's the biggest challenge. And that's core part of Aiden's commitment to serve up, partners and options that meet that criteria. Second question you asked is kind of, well, there's also a cost to the hospital. So, in many cases, our partners are running ACOs, running bundled payments, are in contractual relationships, financial relationships with these partners that they're working with. And so Aiden's got a whole suite built around population management, tracking those special patients throughout the referral process, ensuring that, again, only the right partners that are a part of that particular agreement are the ones that are populating for this patient. We don't end up sending them somewhere else. So that's kind of cost to the hospital, core part of it. And then last thing is like cost to all of us, to the community, to Medicare. Is this a responsible provider? And there's actually some amazing data that now Medicare actually requires, that is shared with patients when they're making a choice, that we've been displaying for years, but looking at readmission rates and discharge to community rates. So we actually provide, badges and certifications to providers who are meeting and doing a good job of getting their patients back home to their base level of care. So there's cost at all levels. And yeah, our goal is to help patients make, the smart choice that they must make, and then also incentivize providers to be focused on delivering excellent quality and cost and getting rewarded as a result.